the importance of why the breast has to go. Okay. And then it's quite supportive with you on that journey. So we always recommend that from day one, your partner comes along.
I guess Gordon is really like, would be interested in, after you've broken the news to the person, then what?
Yes.
What
Where
next?
does the treatment begin?
Yes.
What next?
So the treatment modalities, it's not a one-size-fits-all approach. It differs for every woman. We look at a lot of factors, being your age, the type and grade, and the stage of your tumor. Has it spread? Is it localized? Do you have children already? Do you have plans to have children? Because you need the best for breastfeeding and all that. So we consider a lot of factors. Do you have a family history of breast cancer, where I'm more likely to have breast cancer recurring again? I somebody who tends to have lumps often. And it's more of a multidisciplinary team or approach, in the sense that it's not just one person who sees you. You have the psychologist on board, you have your surgeons on board, you have the pharmacist on board, because of the medical treatments alongside. You have the oncologist, radiotherapy, because of the radiologist, and all those things. So it's a multidisciplinary approach. It's not just one person, one doctor treating you. And it's a whole process. From the first time it's detected in you to the time when you do the scans and the mammograms, and then you're finally referred to see the surgeons and do the biopsy and all that. Depending on what we think you have, depending on your stage and how early it's detected, we'll let you know the options available. We have surgical management. With surgical, either we do a lumpectomy or a mastectomy. With the lumpectomy, where the tumor is located, we take that bit out. Okay, so we don't take the whole breast. That's like a partial mastectomy. So we take that part out, and then the tissue surrounding that area, we take that part out as well. So we salvage the breast. It's also known as breast conserving surgery, because we don't take the whole breast off. But with the mastectomy, where we have to take off the entire breast, or when we say cut off the breast, it sounds a bit brutal when we say cut off the breast. So I don't like to say cut off the breast, but we remove the breast, because the breast is not, the cancer or the tumor is either large or it's not localized in one place. So that's the surgical aspect of it. Either you are doing the lumpectomy or the mastectomy. Some choose to do a bilateral mastectomy. So let's say you have breast cancer in one breast. You may actually opt to do take the other breast off as well, because you think that you have a strong genetic history. So you think that you may have breast cancer in the other breast as well. So you just opt for a bilateral mastectomy and have it done at the same time. Others too, during the mastectomy process, they may actually do a breast reconstructive surgery, where we create breast for them. Either we do a tissue flap, or we put the implants in. And with the implants, either they are silicone implants or saline implants. So that's on the surgical aspects of it. And they all have their pros and cons, And then the next other form of treatment modality that we have is the chemotherapy. Those are medications that you take, usually either intravenous or oral. And when you take them, they actually destroy any cancer cells that may remain after the surgery has been done. You can either do chemo before the surgery or after the surgery. Before the surgery, we call it neoadjuvant chemotherapy, but after the surgery, we call it adjuvant chemotherapy. So those are just medications that help with the shrinking of the cells and to kill any other cells that are left behind after the surgery is done. And then we have radiotherapy. Radiotherapy are like beams of energy rays so it's a machine that is sending rays through the breast. Okay, to also destroy any cancer cells that may be present. So that's also a form of treatment that we have available. And then we have the hormonal therapy. And breast cancer cells, usually we have hormones called estrogen and progesterone that make breast cancer cells to grow even more. So in some form of breast cancers where we detect some receptors on them that we know that these particular receptors would attract estrogen and progesterone to them, we give them hormonal therapy that would actually stop or block the breast cancer from growing. So we give some hormones that will stop that growth.
Like it's via an injection or something?
Yes, we inject you, or it can be oral as well.
Okay.
So that's the hormonal therapy aspect. And then we have immunotherapy, where we give you cells that would also, even though it's going to reduce your immune system a bit initially, it ends up making you strong in the end. So those are a few options that are available. The common one that we have here usually is the surgical one, the radiotherapy, and then the chemo.
Okay.
Those are usually done here more often.
Okay. That's the popular one I know, the chemotherapy.
Yes, the chemotherapy.
You have to keep going back to the hospital.
Yes. At least you need, if you've done a mastectomy, you need about 6 weeks chemo. And then if it's a lumpectomy, you need about 3 to 4 weeks. So it depends on the type of surgery that you did. And with the chemo, that's where the stress comes in, because you lose your hair.
After the surgery,
yes,
you still have
need,
to do
yes, you still need the chemo.
Why?
To destroy any other cells that you may have missed, any cancer cells you may have missed. And to prevent any recurrence of, sometimes, breast cancer can recur again. So, yes, even though we've treated, they can come back again. Yes, so...
What happens, for instance, for the person who has had mastectomy, now there's no breast there.
Yes, but they can recur in the other breast. Assuming
let's say you've taken the two.
Oh, no, if you've taken the two, then
you can't get it again,
you can't get it again.
Okay.
That's how most people tend to do the bilateral. They just take the two, just to know that, okay, then I'm fine. I don't have any breast tissue.
Yeah. Is this to say that the cancer that happens in the breast cannot spread to any part of your body? They only live and behave in the breast,
No, it can spread. We have breast cancer, spreading to the bone, the back, the spinal cord. So the person will come with bone pain, or to the liver. The patient will come with jaundice, so that's yellowing of the eyes and the skin. Sometimes even the brain. So breast cancer actually spreads. And that's like the latter, the stage 3, stage 4. And that's why we always say early detection is key. We push people to do the screening before it gets to that stage. Because when we pick it up early, then it's treatable, it's curable, it's a better prognosis. You have a better chance of surviving. As compared to when we pick it up late, when it has spread, the metastasis stage, and it's terrible. You can't even do anything about it. We don't want it to get there.
If you follow the story of Stephanie Benson, she says that, well, she's taking her breast off, but she also opted to take her uterus off.
Yes.
What does that mean?
Because breast cancer is linked to other cancers as well in the female, like uterine cancer, ovarian cancer, and those things. I think she has a history. I think her mother also had breast cancer also. Yeah, so when you have that positive family history and you have mutations in your genes as well, I think most people just opt and say, okay, to be on the safe side, let me just take all those things out. So that I don't have any, it's like some early menopause. So there's no hormones, you don't have any estrogen, progesterone in the system, So those things that make the breast cancer cells grow, you don't have them anymore. So you're safe. So some people do that sometimes.
Okay. The surgery, how long really does it take? How do you prepare a person? Is it painful? I mean, what should I look out for? What should I expect?
Okay. So with the lumpectomy, it's more of a simpler procedure.
Okay.
Since that one is just a little portion of your breast that's going off, you can really spend like maybe 2 or even a day or 2 in the hospital. They don't really keep that long. But with the mastectomy, because it's the whole breast, and some also decide to do the reconstructive surgery at the same time. Okay. So that can take longer to heal. For those who decide to, I'll just do the breast cancer removal. I'll do the mastectomy now and then probably do the reconstructive surgery later. That also, they'll give another date to do it. So that's also a different way of handling it. But it's not a very painful process per se. It's like doing any other surgery. Just that you just need that emotional support from family, from your spouse, and from friends. Okay. Because it's you are going through a lot at that point. And women, when it comes to our breasts, everybody wants to have their breast intact. You want to go out and have your cleavage on, your cabine slit on, you want to look good and all that. So when the breast starts to go, like MFI likes hipping up there. MFI, he likes showing cleavage a lot.
They like
so I can't imagine somebody like MFI who likes to show the cleavage. Yeah. So I have to now break some bad news to MFI. MFI have to let your breast go. Imagine how she'd feel at that moment. You get it? So it's like your whole world, psychologically. Yeah. So that's why the psychologists also come in.
And even apart from showing the cleavage, it's just, the makes whole
like a woman, you feel like, you feel like...
And that makes me wonder, so the lumpectomy where you're taking just a portion of the breast, do most people do you feel it? Or it can be felt?
And can
you see that a part has been taken?
Yes, you can see. You can see. So what they do, that they can try and create some, do a flap and stretch the skin of the breast a bit to make it, to shape it a bit, to cover it up. So that it's not so obvious that there's a deformity over there. Yeah, so they try and cover it for you.
Okay. I'm interested in what stage it really can get to that the doctor has to insist that we have to take it off.
Yes,
Or you'd have to agree that we have to take it off. And even when it starts as a lump, how many years or months does it really get for it to be bad, you know?
Okay. So besides the lump, you know, the other symptoms that we have in breast cancer, like the bloody nipple discharge, that'll let you know that definitely it's breast cancer you're dealing with, you know. And then when the lump starts to become painful, definitely it's breast cancer. Because usually when the lump is there and it's painless, I mean, I think of a benign lump. But when it starts to have pain, it means this thing is spreading because it's going beyond the breast wall and into other areas. You know that where the breast is located, you have the chest wall underneath and all that. So those symptoms will guide us, let us know, okay, this might be a cancerous thing. There's pain, the skin is scaling off. She's having that orange peel appearance of the skin. The color has changed. She has some sores all over. She may have enlarged lymph nodes in the axilla, the armpit area, and all those things. So that kind of helps you know
that. Is it hard or is soft?
Usually in breast cancer, it's firm. So it gets very hard, yeah. So you know that definitely this is the breast cancer patient you're dealing with. So most likely you have to do a mastectomy for them. So based on that, and after doing the mammogram or the scanning, seeing the reports, after doing the biopsy as well, the biopsy is when we take a bit of tissue, where we think the tumor is or where we think the lump is. We grab it a bit, take the pathologist, is looking at the microscope, and then we kind of see what kind of cells underneath them. When we see that they are cancerous lesions, then we know that, okay, definitely, we would have to advise the woman that we have to, based on where it is, the location, the spread, and the grade, we have to take the whole breast off. So that's when we get to know that this is time for it to go, the breast has to go.
Are more women accepting the conversation of mastectomy, are they?
Not necessarily, and that's our challenge now. You know, most people will go to prayer camps, they'll go to herbalists, and when they come back, it's even worse than you know, they started on before. You know, they'll come with bad ulcers and wounds around the breast. The nipple just looks horrible. So, and that's why psyching somebody's mind from the initial process is very, very important. And having that spousal or family support is important from the beginning. Because if you have already psyched her mind up, when you now get to a stage where she may have to take off the breast, she will understand why she's taking the breast off. That's for her own good. If I don't take this breast off, it's going to spread. I'm going to die. When they have that picture in their mind, it's easier for them to agree to have it taken out. But when they don't have that in their mind, they haven't psyched them about it, and then they are just thinking, oh, okay, I can go and try this and come. You know, they'll not be playing with other things. Then we have a huge problem on our hands. So I think psyching the person is very important from upfront.
Okay. What's the survival rate currently?
Well,
is it looking good?
It's not that bad. You know, we unfortunately, in this part of the world, we don't do a lot of studies and research on breast cancer. So we don't have rates. But however, I'll say that when it's picked early, it's curable.
Yeah.
Yes, you can survive. I mean, there's so many survivors besides Stephanie Benson. I know about 2 survivors that are okay. I mean, they went through the process and they've been healed completely. You know, so if it's picked early, it's treatable and curable. And it's when it's picked late, that's when we have an issue.
Always the problem. I mean, even malaria, if you report it late, it's always a problem. Okay, the mastectomy, when they take off the breast and you haven't reconstructed, basically your breast will be like.
Yeah, it will just be bare, yes. You just see the scar, the line over there. Yes.
Okay. And the cells over there also die. So when I touch the person's chest, will they feel it?
Oh, they'll feel it. They'll feel it all right.
I mean, on the muscle side, okay.
Yeah, it's just that, you know, if the nipple is gone, sometimes we do the nipple sparing mastectomy where we keep the nipple.
Oh.
Yeah, so it depends on how the mastectomy is actually done.
Okay.
But if we take the thing completely off, no nipple is there, nothing. You know, usually the nipple is where you get sensory information. Yes. That's where most of the feelings.
Then it's totally gone then. I mean, not to scare anybody.
I hope I'm not scaring you this morning.
God forbid, though.
God forbid, you're safe.
Not at all.
You're safe, don't worry. So, I mean, it's all these things that you have to look out for.
If we spare the nipple and it's on the chest, I mean, mainly because we're doing the cheating this morning, if the nipple is on the chest, it is not sitting on any breast. If I touch it, I will get feelings.
Oh, yes, you will.
So that's where all the
there's still some breast tissue. Not like we.
Oh, okay.
There'll be something small there. There's something a bit of.
What about what breastfeeding? Like, what else can you do with your nipple over there? You know, can you breastfeed?
Well, you have another breast there, unless you're going to take the two off. But if you have another breast, you can breastfeed with that particular breast.
Okay, but the hard truth of if you don't have the two,
if you don't have the two,
breastfeeding is not an option for you.
No, and that is why usually we always. I always say it's not like a one-size-fits-all approach because we consider other factors. Like you're a young woman, you may want to have other children later on in life. You don't have any kids or something. So I'm not going to take a 20-year-old and just do a mastectomy for a 20-year-old who I know she hasn't yet had her kids yet. Because how does she breastfeed? The main function of the breast is to actually produce breast milk and breastfeed. That's why the breasts were made. Even though the men always think for other purposes, but that's the main function of the breast, is to breastfeed. So before I go and consider taking the 20-year-old's breast off, I have to be sure that really, indeed, the cancer must be that bad before I take it off. Because I know that definitely she's going to have kids someday and we need that breast to breastfeed. So we'll consider all these things before we just go in and take out the breast.
Okay.
No.
Okay.
I mean, we can't go without asking this question, of course.
Sure.
I mean, besides the risk factors that we've learned about over time, are there any, or is there any role that men can play, like partners can play, in ensuring that women don't really, if it's just their risk factors?
Okay.
Basically, is it true that they should be that this conversation?
Is it about the second one?
Oh no, I didn't say. You see, I asked my question. Why are you?
No, because that's like a common question.
I'm also adding a question.
I'm adding to it. Okay.
But you see, I'm taking
that's the angle he's taking the thing.
But me, basically, like the myth. Is there a myth?
It's a huge myth.
Where partners can play.
No, when it comes to, you know, there's the myth that when a man sucks the woman's breast, he's sucking out the breast cancer cells from the breast and all those things. I mean, or that's going to reduce the chance of getting breast cancer. Those are myths. They're not truths.
It doesn't.
Breastfeeding a baby, it's a protective factor for the woman. That's the breast milk, as the breastfeeding mother producing milk and breastfeeding a baby. That protects you.
Yeah, don't let your science die this morning.
No, I'm learning. Please.
Wake your science out this morning.
Apart from the milk that the baby is getting from the mother, what's the difference between the baby sucking the breast and the partner sucking the breast?
The breastfeeding process, there are hormones that are released during breastfeeding and during breast milk production. But you, as a man, when you are sucking, I mean, the woman is not producing any breast milk at that time. No, the hormones that at that time, that's what the man is doing. Those are pleasurable things. That's totally different. That's probably oxytocin.
Besides, the baby is not sucking. The baby is feeding.
Yes, that is feeding.
Yeah, because he's asking what's the difference between a man sucking a breast and a baby sucking. The baby is not sucking.
It's just milk that is coming out of the breast, isn't it?
But that's the whole.
But the baby meant that some hormones are released while the baby is.
Yes. So that's what protects.
What you should learn most is how to help the test.
Which is what we're coming on to.
That's not quite important. Yes. If a partner actually knows how to also examine the woman's breast, it can be quite helpful. Because most of the time, the men even discover the lumps more than the women.
Yeah, they're touching more.
Yeah, they're touching more. Yes. You know, women we hardly touch our breast. We just wear our brand. Yeah, exactly. So most of the people that report, they say, "Oh, my partner was doing this and then he felt this," or my spouse was doing this and he felt this. So that's where the men come in. You know, it's how you examine your wife. I mean, when we say examine, I mean the appropriate of examining, not like your own play, but you should know how to examine your wife's breast for her. I mean, once in a while, just examine it.
Is there a difference between examination and you doing the other things that could also make you detect? Because you should know your partner's breast, yes. Isn't it?
Yes, yeah. And by examining it, you see, when you are playing, you may not be looking out for certain things.
Right. You are just doing it.
Yeah, just doing it, yes. But when you're examining the woman's breast, you're actually looking out for these particular things. You're looking at the size, the shape of the breast. You're squeezing the nipple for any discharge. You're looking out for any lumps, any obvious swellings here and there. So that's where your mind is.
When there's a discharge, it doesn't necessarily mean something weird is happening, is it?
Nothing should come out of a woman's breast, ideally. Nothing at all. Either a woman or a man, nothing should come out. Unless if you're a woman and you're breastfeeding. Okay. If you're a breastfeeding mother, the milk should come out when I squeeze your nipples. But other than that, nothing should come out at all. Okay, so I think that this is someone who has a mastectomy, from what I'm saying.
Yeah.
Like I see the scars.
Well.
Yeah, this is also,
okay,
so you can see the line, yes.
Yes,
So that one, they did a total mastectomy, nothing is there, not even in the nipple. They didn't spare the nipple at all, yeah.
So when they did, then they also did chemotherapy to
afterwards,
cure.
Yes, to cure.
When you do the chemotherapy and it's just one breast that you're taking, right? do you have to do therapy for the other one as well?
Chemo goes into the blood system, so every part of the body is affected, and that's why they lose their hair and their nails. You know, they just feel tired and all that because it affects every cell that grows within you, basically.
Hoping to kill any cell.
Yes, hoping to kill any.
The detection again, please. I mean, we've seen this severally, but we can't stop talking about it because we're still talking about the awareness. So in the examination, say I'm looking for a lump at my partner's, do I stand behind my partner or have to be in front of her? Can we demonstrate it?
Okay, sure. So before the partner does the lying down bit.
Oh, there's a lying down.
Yeah, there's a lying down bit.
I didn't know.
I know, don't worry. That's why I'm here today.
Okay.
So before the partner actually does the lying down bit, you can let her stand in front of a mirror. Or, okay, well, since I know what I was going to do, you want to learn how to do it for somebody,
yes,
right?
I want to learn how to.
Then now the mirror is when you, maybe I'm the one who is checking for myself.
Right.
So if it's you looking for the person, she'll just face you.
Okay.
She'll lift both hands up. What does it mean? Now when you lift both hands up, your breast would rise up. So if there's any abnormal thing beneath.
I just want to see something, please.
Hey, why are you before this morning like?
Praise God, let me see something. I want to see something. Okay.
You have to be naked, by the way.
Yes, you should have been naked to appreciate
I have
it.
a very imaginative.
Hey, so you can imagine things under there.
No. I'm not imagining.
Anyway, so when you lift both hands up, you are looking out for any obvious change in the size and shape of the breast, whether there's any change in the skin color as well and the texture, whether there are any sores available. You should know how your woman's breast looks like. So if there's any abnormal finding, you can notice, you can pick it up. And then dimpling as well. Dimpling is like the way you have a dimple in your cheek. That's similar thing. So it's like you have holes in the breast, like it's pitting. So you look out for all those. These are all abnormal changes and findings. When you do that, then after the raising up, then you put your hand on your waist like this. That also tenses up the muscle here. So if there's any obvious thing, you can see it before you do the lying down bit. So the lying down bit, you put your hand behind your head, and you use this hand to examine. And then when it's the other way, you change it like this, like what is there in the picture here.
Screen, yeah.
So you just put your arm behind your head, and then use your other hand to examine the breast. And then you use your the first 4 fingers, the flattened bits, and you go around in a circular motion. So you go around in circles. So you go all over around the breast. Then when you're done, you squeeze the nipple. So that's where you see whether there's any discharge coming out. Because sometimes it's not too obvious. You may not see the discharge. But when you squeeze the nipple, something would come out. And then you know that it's obviously... Yeah, gently. I mean, you don't want to be aggressive. Because the nipple is very sensitive. So, I mean, just squeeze it a bit to see whether anything comes out of it. Then you know that there's an issue. And then when you examine the breast, people always forget to examine the axilla, the armpit part. But breast tissue actually extends there. So you also have to go and check there as well.
Go a bit further.
Yeah, so you don't just limit yourself to just the breast alone, but you go towards the armpits as well to see whether there's any abnormal
that is wonderful.
findings. Yeah.
Lastly, is it true that for every woman, the breast size is different?
Yes, it's different. One breast is always bigger than the other.
Okay.
And you should know which breast is bigger. Because it doesn't change. If it's just that particular breast, it'll be like that so you die or something. So don't be alarmed if you see that one is bigger than the other. But when it's abnormally huge and it's that significant, you know, okay, definitely there's something going on here.
They say my time is up. But can the breast grow? The breast can grow, right? Or it stops growing at a certain point. If the woman is growing big, will the breast grow with her?
Yes.
It can grow with her, right?
Breast is fatty tissues, adipose tissues. So
it expands.
Yes. And when you get pregnant, it gets bigger.
The screening happening at Douala Medical Center, right?
Yes, it is.
People can
people can always come in. It's the entire month of October,
all right.
Monday to Friday from 8 a.m. to 2 p.m. So it's open to the public. It's a member camp, so you're all invited to pass through.
Thank you.
I like to see those nurses.
So much. Thank you, Dr. Roy. Always amazing. We'll see you soon again. Okay?
Sure.
All right, guys, let's cross it out. And it's also Cross It Out month on the AM Club. And so we encourage you to go out there and screen. Encourage your partner to screen as well. Gordon's favorite day is Thursday and Throwback Thursday. We had a beautiful conversation with the gorgeous Stephanie Benson. Listen.
Betway is